College, an exciting time for many of our young adults. Freedom from parents' watchful eyes, partying, staying out all night, binge drinking, experimenting recreational drugs. Too often we hear our horror stories of students overdosing and died after partying all weekend. No doubt, drug use and binge drinking are two of the most risky behaviors among college students. And many colleges currently have prevention programs that target these problems. However, do you know that there is yet another high-risk behavior that has serious or even deadly consequences, but is rarely being talked about? Sexually transmitted infection, STI. According to the CDC, STI is the most common infectious disease in the United States, and 20 of them have been identified so far. HIV is not just an infection of the homosexual man or IV drug users. According to the CDC, 31% of the HIV cases were due to heterosexual contact. In 2008, there were 1.5 million cases of chlamydia and gonorrhea reported to the CDC. The age groups that were affected the most were young women between ages 15 to 19 and 20 to 24. As you can see, college students are one of the highest risk groups. According to the 2009 National College Survey, 66% of U.S. college students have had sexual intercourse. 44% had one sexual partner. 22% had two or more sexual partners within the last 12 months. 38% of the students do not use condom regularly. 13% had used Plan B within the past 12 months. 4% had an intended pregnancy. These data indicated that almost 40% of the college students are engaging in high-risk sexual behaviors. At the college center that I currently work at, about one-third of the scheduled appointments are for pregnancy tests, screening for STIs, and treatment of STIs. The average number of sexual partners for our students is around 4 to 5 during the past 12 months. Next, I would like to share with you two of our routine visits at the health center. These are dramatized cases based on actual events. The patients in the videos are volunteer actors.
Hi, I'm Angelina, one of the nurse practitioners here. How are you today?
I'm doing well. I'm Ruby.
Hi. So what brings you into the health center today?
Well, I was wondering about the HPV vaccine and what circumstances you would need that vaccine.
So first tell me, what do you know about that vaccine?
I don't know much. I just wanted to see if I needed to get it.
Okay. So a few things that we need to consider when we talk about the HPV vaccine. It is a vaccine for an infection called HPV, which is the sexually transmitted infection. So then next I need to ask you, are you sexually active right now?
No, I'm not.
Okay. And are you planning to become sexually active in the near future?
Not till I'm married.
Okay, wow, great. That's really encouraging. I'm happy to hear that. So with that in mind, then now we have to think about other risk factors. So are you planning on only marrying a virgin or someone who has never been sexually active before?
I'm not sure.
Okay, that's always a tough one because you don't know what's going to happen down the road. And because of that, so then we have to think about this future husband. If he had any sexual contact in the past, he could be exposed to this HPV virus. Because of that, you might be at risk down the road. So that's something to think about. And do you know how HPV is being transmitted?
No, just sexually transmitted.
Okay, so through intercourse, most people would think through vaginal sex. HPV and herpes can actually be transmitted other than through intercourse, through skin-to-skin contact or oral sex. So to be very explicit, unless you or your future husband always kept the pants up, okay, then there's no risk factor. But if at any point that wasn't the case, at one point or another, you or him could be exposed to the virus. And because of that, then you have to think about, do I want to take that risk? So So those are the factors that you have to consider for yourself, whether you want to sex.
So thank you very much, and I think I'll consider it once I find that person.
Okay.
Yeah.
Hi, I'm Angelina. How are you?
Nice to meet you.
Nice to meet you. So what brings you into the health center today?
I'll just cut to the chase. I'm in here for counseling.
Okay.
I've been seeing this girl for a couple of months, and I was pretty sure that we were in a serious relationship. She wasn't getting the same idea. She cheated on me.
Oh, I'm sorry.
Yeah, it's not the worst part. She contacted me about a month and a half ago and told me she got chlamydia from the guy she was with. And I mean, I don't know what chlamydia is. I don't know what the symptoms are, but I haven't been showing anything. I've been pretty normal. I'm just trying to keep positive because I don't really know what's going on right now.
Okay. Well, I'm really glad you're here today. So first thing, I will refer you to our therapist who's on campus. She can give you some further counseling, on-campus support, emotional support. But then next, I want to ask you, has your girlfriend been treated?
No.
No, okay. So what I would like you to do today is I want you to we want to run some tests to see if you're infected with chlamydia. It's good that you don't have any symptoms, but I'm afraid to tell you that 80% of the people who's been infected with chlamydia or gonorrhea have no symptoms. So with that, we need to run some tests, but also according to the CDC guidelines, we need to treat you right away, okay? Because chlamydia is such an infectious disease that we want to treat anyone who's been exposed to it immediately. And also, the next step is to test you for everything else because we don't know what else you might be exposed to. Okay? You okay?
Yeah.
Okay. So I want to take care of the physical aspect first today, and then we'll refer you to the therapist to give you some more support.
Whatever you think is best.
Okay. So I'm going to have my assistant come in to help you, and I'll talk to you afterward.
All right. Thanks a lot.
While many colleges have drug and alcohol prevention programs, it is time that we bring this hush-hush problem to the forefront. Educating college students on the consequences and the various types of STIs would encourage abstinence as well as promote safe sex practice. Encouraging screenings and early treatment for those who have STIs could potentially prevent many terrible consequences. Sometimes a simple dose of antibiotic is all it takes to cure a bacterial STI. Hi, my name is Angelina Chow, a board-certified family nurse practitioner working in the San Francisco Bay Area. If you have a child who is in college, I urge you to join me in advocating to your college administrators to implement a sexually transmitted infection prevention program on your college campus. Thank you for your consideration.